What are some symptoms of scoliosis? Patients with scoliosis can experience many different problems and many different situations that could be a result of their scoliosis. And when we look at scoliosis, we know there's different types. Idiopathic scoliosis is the most common type of scoliosis, and idiopathic physically stands for unknown cause, meaning we don't know why the patient's actually developing scoliosis. This accounts for 80% of all known diagnosed cases of scoliosis. So for the majority of patients, when they ask what's causing my scoliosis, we physically can't answer them. It's an unknown cause. And anybody who says they know the singular cause for scoliosis is literally just guessing. There are many, many theories. In fact, idiopathic scoliosis is considered to be a multifactorial problem, meaning that it can be patients that actually have multiple factors that could be contributing to their scoliosis, not just one. And more likely, there's different causes for different people. It's never just one thing. The remaining cases, though, do have known causes, the remaining 20%. And this is something called neuromuscular scoliosis, congenital scoliosis, degenerative scoliosis, and also something called traumatic scoliosis. Scoliosis does affect different age groups. Unfortunately, it does affect all ages from infantile to elderly. However, the most common age or the most common diagnosed scoliosis is between 10 and 18, something called adolescent idiopathic scoliosis. Idiopathic scoliosis is by far the most common type also to affect adults. These are adolescent cases that go either undiagnosed or untreated or unresolved, and now they focus into the adult, they move into the adult form, and now they're dealing with the progressive nature of their adolescent scoliosis in the adult. They call this adult idiopathic scoliosis. So we're going to focus mostly on what symptoms idiopathic scoliosis can present itself with. However, the other types of scoliosis, neuromuscular, congenital, traumatic, and degenerative scoliosis, all could share these symptoms, but they also may have the symptoms associated with their particular syndrome. Like if you have neuromuscular scoliosis, and let's say you have Marfan syndrome, you may have ligament laxity, you may have some cardiovascular issues, you may have some eye issues, and you may get all these symptoms that are also associated with idiopathic scoliosis. So regardless of what type of scoliosis you have, understanding that scoliosis affects the body structurally and can lead to these kind of problems, it's important for you to know. First thing is we know that scoliosis affects or introduces uneven forces to the body. This uneven forces is a result of asymmetrical compression or gravitational forces through the spine into the pelvis, legs, and feet and knees, and up into the shoulders, and of course extending into the skull, because anything that attaches to the spine is getting an uneven force, either through compression or through pulling through the soft tissues. Normally, these uneven forces result in a postural deviation that's significant. Normally, you can see shoulders unbalanced. You can see rib cage unbalanced. You can see the waist and hips unbalanced. You can see uneven spaces between the arms. You may see even balance or postural deviation from the side. Normally, this type of postural deviation associated with the abnormal weight bearing or abnormal distribution of weight throughout the body can lead to balance and coordination issues. There's a lack of balance, a lack of coordination, a lack of proper proprioception because the body is adapting to this asymmetrical weight bearing. Interesting enough, since scoliosis affects the torso and normally the length of the torso, it can also be associated with digestive issues, especially as patients age, as their digestive system could be affected. We're not sure if it's affected because of as the torso curves or as the curves increase, the torso shortens and it leads to a lack of space for digestive organs. We don't know if it's neurological as a result of the spine shifting and the lumbar spine affecting the nerves that could go into the stomach, large and small intestines, how that could possibly affect digestive issues. It can also lead to headaches and migraines because most patients that develop scoliosis also develop a lack of normal alignment from the side of the spine, and this can affect the neck primarily, which can lead to headaches and migraines. These common symptoms in adolescence mostly are the postural changes that we notice. We see significant postural changes in adolescent cases, and in fact, it's the number one reason that leads to a diagnosis. Normally, the child will go in for either a pediatric visit, or the parents will notice it, like typically when they're in a pool or beach where the patient's like wearing a bathing suit, or they'll get an examination or a screening done in school, and they'll notice posture problems. Normally, that posture problem, you'll get referred over to a specialist, like an orthopedic orthopedic doctor or even a chiropractor or some type of therapist that can actually look at the scoliosis. And normally at that point, they're prescribed x-rays to confirm the presence of scoliosis. But the posture changes is normally the number one thing that brings on the diagnosis in an adolescent. However, the most common thing that brings on a diagnosis in the adult is normally pain. Pain is the number one symptom that we tend to see in adults, where we very rarely see pain in children. And the reason why is because what's causing the progression. In adult forms, patients are no longer growing. So what's happening is the compression of gravity over time is leading to the compression of the nerves and tissues around the spine, which can lead to pain. In children, they're growing, which is elongating. This doesn't compress nerves and tissues, so they normally do not feel pain. If they feel pain, it's normally a very dull ache at the site of curvature, and it may not be much different than other patients or other kids that are just growing and carrying books and going back to school. They may have some dull aches, but nothing severe, where scoliosis in the adult form almost always leads to pain. Now, what's interesting with adult cases is that the pain that they feel is not always directly related to the size of curve relative to somebody else. And this is what I want to explain to make this very clear, is let's say you progress to 25 degrees as a child, you have no pain, and you progress to 30 degrees as an adult. That 5 degrees may become very painful for you, and you have a 30-degree curve. Let's say you progress to 80 degrees as a child, and you hold your curve at 80 degrees. You may experience no pain. It's the amount your curve progresses as an adult is the number one indicator why somebody would feel pain or not. Now, it is true, the bigger your curve as an adult, the more likely it is to progress as an adult, and the faster it will progress. But we see patients that come in our office in the adult form, and we just reduce their curve to what they have memory of your curve being, and a lot of their symptoms resolve themselves. So it tells us that if adults hold their curve and don't let it progress in the adult stage, that they're going to most likely mitigate the effects that the pain could have. But having scoliosis does predispose you to this compression problem that could lead to pain throughout your age or as you age throughout your life. So what are some of the factors that could affect the symptoms associated with scoliosis and how bad they become? Well, first thing is patient age. We know the older you become, the more likely scoliosis is to cause more problems, meaning as you age, the curve will not only progress faster, but as it gets bigger, it also progresses faster. And as you age, it causes more damage and more deterioration to your spine, which can lead to more pain and more functional problems to your spine and well-being. We also know the type of scoliosis, meaning if you have a neuromuscular condition associated with your scoliosis or some kind of congenital deformation, it's more likely to affect the severity of your scoliosis and how it affects your life than a case that may not have so many other issues associated with the causation. Curve location. Normally, the lower the curve is, the more likely it is to cause pain. However, the more in the mid-back your spine is, as it becomes severe, what I mean by severe is 60 plus degrees, it's more likely to cause maybe some pulmonary malfunctions. And we also know severity. The more severe your curve becomes, the more likely it is to cause problems meaning mild curves. So mild curves under 25 degrees are much less likely to cause issues, even though it doesn't mean they're not going to lead to issues. So the diagnosis of mild, moderate, or severe, these categories are only related to using surgery as a treatment option. They're not really related to whether the potential of it causing a problem. It's only related to, is the curve severe enough for surgery? So the severity of the condition is relative to that person. Like I stated, if you have a 10 or 15 degree curve as a child and you progress 10 degrees and you only have 20 degrees as an adult, that 10 degrees may cause severe pain and disability for you, where it may not if somebody has a 40-degree curve and doesn't let it progress at all and they just maintain their 40 degrees. So it's not always related to the size of the curve, it's related to how much you progress as an adult. We know scoliosis symptoms can be managed through proactive treatment, meaning If we stop and slow down your curve from progressing, or even better yet, we actually reduce the size of your curve and reduce the impact that your scoliosis is having on your body, we know we can actually deal with the things that are causing the underlying problem to the things that you're experiencing. Most patients with scoliosis, most of the time they get their symptoms treated, but their curve remains untouched, meaning the curve's still progressing, it's still causing more problems, and their conditions tend to worsen and worsen over time. So therefore, I recommend treating what's causing the problem. There's a very big difference in treating a patient with scoliosis versus treating a patient's scoliosis, meaning actually making it better. Our job, what we recommend, is that, and especially at Scoliosis Reduction Center, these treatments are actually reducing the curve as opposed to treating the patient with scoliosis. We're actually trying to treat their scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.